Good afternoon, everyone. Welcome to our Back to Basics webinar series. For those of you who have joined us before, we're glad to have you back. And if this is your first time joining this webinar series, we're glad to have you. I am Casey Zimpel with the Superior Health Quality Alliance Chronic Disease Management Team, and I will be your facilitator. Please take a minute to enter your name, organization, facility, and role in the chat so everyone can get to know who joined us today. Please use the chat box to submit any questions or comments, and we'll have a verbal question and answer session at the end. As I mentioned, today's session is a part of a webinar series. Webinars are the third Tuesday of each month and occur at 12 p.m. Central Standard Time, 1 p.m. Eastern Time. On this slide, you can see some of the future topics we will be discussing. Our session next month will be focused on the importance of health literacy and chronic disease management. I am pleased to introduce to you Michelle Farrell, our speaker for today, owner of Boscobel Pharmacy in Boscobel, Wisconsin, and Center Pharmacy in Richland Center, Wisconsin. Michelle is a graduate of the University of Wisconsin-Madison School of Pharmacy. She's also the past president of PSW and a lead luminary and network facility for CSPN Wisconsin. Michelle also has a lot of other credentials. She'll probably review quickly for you, but then we'll get into our presentation today. So I'll turn it over to you, Michelle.
Thanks so much, Casey. I really appreciate you and really appreciate the opportunity to talk about this topic, which I'm so passionate about. I don't know about all the other credentials. I've been a community pharmacy owner for about 20 years now, so I learned by the School of Hard Knocks, but I've been really proud of the work pharmacists have done in the area of vaccination. So I look forward to sharing with you all of the updates that we've got for this upcoming respiratory vaccine season. So if you want to move on to the next slide, I'll let you all read the objectives for today. We're going to go through some of the latest vaccination guidelines for key upcoming vaccines, discuss co-administration of vaccines, so prep your questions now. Talk a little bit about vaccine acceptance and how to promote that patient confidence in vaccine, and then discuss a little bit about the importance of collaboration around meeting patients' needs, especially in the realm of vaccine provision. Next slide. So we'll start with some vaccine guidelines and recommendations. You've got links in a lot of these slides to further resources. Superior Health has just a treasure trove of references and resources. I really encourage you to explore, but I'm going to share some ACIP guidelines in the upcoming slides. So next slide. First, we've got recommendations around the adult immunization schedule for ages 19 and older. There's a link on this slide that will take you to those 2024, 25 updates. And in the realm of influenza vaccine this year, you're going to hear the word trivalent used a little bit more than used rather than the quadrivalent. So this year, and we're shifting to a trivalent vaccination due to the data surveillance that's happened since March of 2020. We saw elimination of the B Yamagata strain of flu, which I think we can all, as healthcare clinicians, really celebrate the fact that the public health precautions we put into place during COVID essentially, eliminated a strain. Therefore, ACIP made the recommendation to back down to the trivalent. Same will hold true as far as a vaccination that's prepared for people under 65, and then we'll have a high dose vaccine for people over 65. So next slide will illustrate a little bit of the ACIP guideline around the composition of our 2024-25 vaccine, and you'll see in that B realm that the Yamagata is not listed this year. However, there's the strains of influenza A maintain. And then in the next slide, just reiterating the for all patients over 6 months of age should be receiving a flu vaccine if they don't have contraindications. ACIP is recommending that high dose trivalent vaccine for those over 65 and anyone having received a solid organ transplant ages 18 through 64. So exploring the coverage of that is important as we take care of that frail population. Next slide. So as all of, pharmacies are getting ready to roll out vaccination, I think it's important to talk a little bit about timing reminders. We certainly want to get that vaccine in arms before we have any outbreaks. However, typically we're suggesting that older adults especially receive it September and October. Those who like pregnant persons, children requiring 2 doses, we may scoot that to July and August, but largely we want to see vaccines in arms in September and October, which should pair well with our updated COVID vaccine, which we'll talk about in our next slide. So if you want to move on to the next slide. Just as we encourage flu vaccination in our populations, just looking at these stats from 2010 to 2023, when you start stating that there's been almost 41 million illnesses and about 51,000 deaths in the time between 2010 and 2023, I think it really highlights that importance of getting those vaccines in arms. Vaccination, our flu just puts an incredible burden on our facilities, and it's so important. It's just an easy preventable offer for our patients. Next slide. So COVID-19 update, as we talked about before, we're recommending a new dose of the 24-25 formulation, which we should expect hitting pharmacies really soon. Most of the previous vaccine has expired. We're seeing lower levels in our community of patients or of facilities having that vaccine on hand. We're largely waiting to get new vaccine to vaccinate. And any day now, we should see that coming out. I don't know if in the chat, if you've got any on hand at a facility, I'll come after you, but I'm checking McKesson every morning to see if it's been released. My understanding was late last week, we were supposed to see some initiation of receipt at the wholesalers with release likely sometime this week, along with flu vaccine hitting some stores around us this week. So with the next slide, it'll go through the 2024-25 COVID vaccine recommendation for anyone over 6 months of age. Again, looking at that COVID 2024-25 formula, this time it's going to be a monovalent strain. And we're, again, any day now. So it's a really optimal time to be discussing vaccine planning with patients, facilities, et cetera, so that we can make sure we get vaccine in arms as the fall rolls out. Next slide. So with COVID implementation or vaccine implementation, I think it's important to consider the presentations because it has been a little bit more complicated. As we see the 2024-25 formulation come out, we see preparation largely unchanged. Moderna will remain a frozen presentation that once you pull it to refrigerator storage is good for 30 days. Novavax is refrigerator stable. And then the Pfizer continues to have the ultra cold storage, which once pulled to the refrigerator has a set expiration. So that, as I tell my patients, we just have to do a lot of timing around ordering in COVID vaccine and preparing to get it in their arms, and an appointment-based model has really helped in some of that. Again, at that Pfizer vaccine being ultra cold does require dilution for 6 months to the for the 6 month to 4 year old formulation. So keeping that in mind as we work in our clinics, the preparation piece will take some planning. Next slide. So COVID vaccine insurance coverage for 2024-25. Most insurance plans, I haven't ran into an insurance plan that doesn't cover COVID, because of the requirements put forth through the CARES Act. Medicare is covering it. Medicaid beneficiaries also have access. Uh, Eligible children can receive. One piece I wanted to bring to bear, though, was that the Bridge Access Program will sunset at the end of the month. So that will not be available to the uninsured. So, working with health agencies and whatnot to help those populations is going to be really important. Next slide. And the COVID burden, I think looking at these stats was interesting to me to think about protecting our most fragile humans, which I place in the over 65 and the under 6 years of age realms, because they often need our help for really good protection. And we see that 2/3 of all of our COVID-19 associated hospitalizations were among patients aged 65 and over. And looking at vaccine rates, about 11% received a 2023-24 vaccine dose prior to admission. So I think that, just vaccine burden that we've seen over the last couple of years and lots of new things coming out, as clinicians, it's just really important to maintain your excitement over getting a vaccine in an arm and relaying how important it is for that to happen for those patients. Certainly underlying conditions remain an increased risk for hospitalization, but age remained a strongly associated risk with hospitalization. And on the next slide, you'll see the flip with rates of COVID being highest among kids under 4. So it's just really, again, highlighting how important that vaccine is. During that time frame, October of 23 through March of 24, 5% had received a vaccine prior to that hospital admission. So again, looking at that, those patients that are really fragile is important to continue to encourage vaccination. As we look at COVID vaccine safety overall, anaphylactic reactions have been rarely reported. There's a rare risk of myocarditis and pericarditis, predominantly in males ages 12 to 39. There was some ischemic stroke and GBS signals, but those were largely seen in adults over 50 and 65 respectively, which may correlate. And again, reactogenicity symptoms are overall less frequent and severe among older adults compared with adolescents and younger adults. So as we think about being cautious as we administer these and what kind of symptoms are they going to have 24 to 48 hours afterwards, discussing with patients how they've responded before, and that those responses will likely be consistent or wane as they get older is important. Next slide. RSV vaccine and updates. So ACIP has guided that all adults over 75 should receive a RSV vaccine. There are 3 currently on the market. They're listed on the slide. And then ACIP is recommending that adults ages 60 to 74 who are at increased risk of severe RSV. And I've got the diseases listed out on the slide. Largely patients that are frequenting our hospitals and clinics and pharmacies should receive a single dose of RSV vaccine. So another just reminder to take care of those patients with chronic conditions. Next slide. I really liked this presentation from the CDC. Seeing it in picture form helps me remember that consistent over 75 get an RSV, and then 60 to 64 look at those chronic conditions, or if they live in a nursing home, they should be getting the RSV vaccine. Next slide. So as we look at RSV burden, again, looking at those populations that are at higher risk, those patients with heart failure and the immunocompromised with rates over 20% of hospitalized patients with RSV have those comorbidities. And then looking at the patients that are in long-term care facilities, that close proximity really puts them at an increased risk of all respiratory diseases, but especially RSV with resulting severe outcomes. Next slide. And as far as vaccination coverage, looking at the Medicare population, about 20% were vaccinated. Certainly lower rates in rural areas with patients that are uninsured with a low household outcome, low household income or a lower educational level. So really working with patients to address those social determinants of health, I think, are important as we look at increasing those RSV rates. Next slide. So pneumococcal, a few updates in the realm of pneumococcal as well. We had the PCV 20 come on board last year. We're going to see a 21 this year. So again, looking at those recommendations for patients over 65, and then looking at comorbidities and where we should be getting vaccines in arms, especially in those who are diabetic, kidney failure, heart and lung disease, have recommendations for pneumonia vaccine before the ages of 65. Next slide. So the following groups we currently recommend to receive a dose of pneumococcal conjugate vaccine: those over 65, or those who are aged 19 to 64 with underlying conditions as revealed in that previous slide. And then certain adults who have received PCV 13 but haven't received a PCV 20, we do want to get that updated vaccine into those arms as well. Next slide. So a little bit more on the PCV 21. It was approved in June. I have not seen it yet circulating in pharmacies, but it seems to interchange as an option for adults over 19 who have a current recommendation to receive a dose of PCV, and adverse effects typical of vaccine with injection site pain, headache, and fatigue. So with the next slide, I believe I provide with all these pneumococcal vaccine recommendations, it's really tough to keep them straight. 13, 20, 23, 21. We're really narrowing it down to the 20 or 21 now, but taking a look at downloading or making that Pneumorex Vax Advisor available to your clinicians is really a really helpful tool. My pharmacists use it every day in making a vaccine determination. Additionally, the CDC has an app that you can download to help with just all the vaccine recommendations. So really encourage those available in your facilities. Next slide. And Zoster is the one vaccine on the list without an update, but we do want to see 2 doses of Zoster vaccine for patients 50 and over. Lots of comorbidities when patients realize a Zoster infection, and with vaccine we still see some occurrence of Zoster, but it is way less pronounced than patients without Zoster vaccination. And some of the worst pain I've ever seen has resulted from a shingles infection. So really encourage that in those adults ages 50 and over. Next slide. So vaccine co-administration is a very important topic. We especially as we've rolled out multiple vaccines during respiratory season and take into consideration patients' willingness, as well as some of those social determinants of health around transportation and understanding, et cetera, really make us inclined to co-administer vaccines as appropriate. So with the next slide, I present some of the ACIP guidelines in the US for spacing of live and inactivated vaccines. And really, all of these vaccines that I've presented this morning are non-live, so they may be administered simultaneously or at any interval between doses. So as we're making a plan for patients, especially around those respiratory vaccines, really meeting the patient where they're at is always important. But if time is of the essence, getting those vaccines in arms, and during respiratory season, time is of the essence. The vaccine is protecting them from a potential deadly occurrence. So offering that as a co-administered product is entirely acceptable. And with the next slide, to some same-day clinic, different anatomical sites are an offering you can make to patients, certainly different syringes. If you are administering in the same arm, separating those vaccines by an inch is what's recommended. And with the next slide, I think we've got the CDC's recommendation around administration of or co-administration of vaccines, and really considering whether the patient is behind or at risk of becoming behind on recommended vaccines, their risk of vaccine preventable disease, and then the reactogenicity profile of the vaccines. And again, just generally speaking, as patients are older, that reactogenicity profile is reduced a bit, and that can really, enable them to comfortably experience co-administration of vaccine. Next slide. So vaccine acceptance and confidence. And I think this is a piece I was just talking with my pharmacists about, and reminding us that we're a trusted healthcare professional in our community, making these recommendations to patients at every exchange with the patient is really important. Not just at flu vaccine season, though we ramp up real high to go through things, having an active discussion around vaccines so we can get their questions addressed in a respectful manner and give ourselves some time and preparation is important as well. And with the next slide, the CDC provider or patient acceptance strategies, that provider recommendation is really at the top of the list, and honing your motivational interviewing skills, but also helping them with planning and formatting some reminders and messaging around vaccine. Do you have vaccine ambassadors on your team that are reaching out to patients that patients really see on their level and wanna interact with? Do you offer financial incentives or gift cards, et cetera, for being completely vaccinated? Have you offered patients who may be homebound or afraid of coming into a clinic situation, especially during respiratory season, an alternative option? And are you working on combating misinformation? Combat is a strong word, but how are you messaging to your community and patient population? And I encourage you to take a look at in the next slide, there's some CDC recommendations around sharing and really tailoring your vaccine recommendation to patients, highlighting the positives, addressing questions, and reminding patients how important it is to get that vaccine, and not only themselves, but also their loved ones, and explaining the why, the costs, the missing work or family events, those pieces as we've worked through the COVID vaccine rollout, just all of those really as we've worked with patients, established relationships, they may not have accepted vaccine the first time they were in the pharmacy, but as the season wore on, hearing of others' issues, were more likely to ultimately take the vaccine. So with the next slide, I think, willingness to accept that vaccine falls on a continuum for most of our patients. Some of them refuse, some of them want it right now, but a lot fall in the middle where they need more information. And again, positioning your organization to establish that you're here to answer patients' questions is important. Next slide. Again, I highlight a little bit of the importance of patients, Americans seeing other respected individuals getting that vaccination or planning to get a vaccination has been, helpful to helping patients understand how important it is to get that and really build their confidence in receiving the vaccine. And the next slide. No question is a silly question. I put out some cloud points of common questions we've received over the last year, and being prepared to answer these questions. And Superior Health and has a number of resources around the letstalkshots.org website. Really encourage you to have your teams take a look at some of those resources for answering these questions. Next slide. And one of the slides that my pharmacist team has really found valuable as we talk to patients about vaccine acceptance is illustrating COVID cases versus deaths and when that vaccine was starting to be placed in arms, seeing the leveling out of the deaths versus cases as that rolled out is a really telling, I think, illustration of the importance of vaccine and reducing that disease burden. Next slide. Another piece that is important to share with patients is that vaccines are not going without review. There is a vaccine adverse event reporting system. Your teams can link to the reports using the links on this website and providing that information to patients that if they were to realize an adverse event to report back so that we can collect that information is another way to ensue some confidence in the patient's acceptance of vaccine. And then the next slide, we still encourage V-Safe, especially around the mRNA vaccines, COVID rolling out again, as well as the Resvia for RSV, have a V-Safe recommendation so that we can watch the safety of those vaccines and how patients are responding once they take that vaccine. And clinician collaboration. So in this area, I find in our communities, it's worked really well for the pharmacy, the clinic, the county health department, and the free clinic, et cetera, to be on the same page around where vaccines are available, when patients can get them, so that patients have a really good experience when they hit the doors of wherever they would like to get the vaccine, so that they're going to a location where there is especially COVID vaccine readily available, since that one tends to be a little bit more reserved around handling. So with the next slide, respiratory disease considerations certainly becoming more complex. So again, having staff well educated on the updates, the changes, the handling process can constitute some confidence in patients and an understanding within the community where vaccine is going to be available. Understanding where the financial burdens might fall and who can bill for vaccine or who has access through the end of the month to the access program. And then just recognizing that fewer primary care practices may have the COVID-19 vaccine on hand due to some of the barriers around handling. So assuring where those vaccines are available is really important. Next slide. Um, Pharmacies provide great vaccine access. Looking at some data last night, over 80% of vaccines in the United States last year that went through claims management were administered in a pharmacy. 89% of Wisconsinites live within 10 minutes of a pharmacy, and through my involvement with the Community Pharmacy Enhanced Services Network, or CPSN, we see that stat to be fairly true across the nation, where patients live within 10 minutes of a pharmacy, and patients typically walk in and receive care. Pharmacies engage high-risk Medicaid patients about 35 times a year between prescription dispensing, supply dispensing, OTC recommendations, and pharmacies offer walk-ins, appointments. Some pharmacies offer curbside administration, so they'll actually come to a car, or Medicare has allowed in-home payments for COVID vaccination administration. So pharmacies have made that service available to patients. But again, collaborating with area pharmacies or clinics, health departments, and determining who is offering which services is really important to helping some of our most frail receive those vaccines. Some pharmacies have community health workers within them, and they're reviewing social determinants of health and helping address the SDOH challenges around vaccine administration, whether it's an understanding of the importance of vaccine, or helping the patient remember, or just helping the patient get the vaccine through a clinic or a home administration is something that some pharmacies in Wisconsin are also offering. So next slide. The American Pharmacists Association, which you've got the link at the bottom, has an immunization center. And I've actually had some patients who have also brought in a vaccine plan from their primary care physician and really found this to be something the patient appreciates, and the pharmacy appreciates it as well, because we can help time the vaccines if the patient doesn't have an upcoming medical appointment. So giving the patient the ability to plan around travel and life events is really helpful to them accepting that vaccine administration. And then the next slide just kind of goes through, say if someone was to turn 65 in September, being able to list out the vaccines that they need at those, key age points is helpful, as well as providing a print off from some of the registries that we have available. And I think on the next slide, I provide a link to state immunization registries. And in Wisconsin, I'm not as familiar with Michigan and Minnesota, but there is the ability to print off an age recommendation for vaccine for patients, which is a really helpful tool. Patients often appreciate having the list of what they've gotten and what's recommended coming up, and then they can utilize that between whatever healthcare provider is available to give them that vaccine when they're ready. So next slide. So other clinician collaboration opportunities, just really using these educational resources for the staff and for public through messaging, handouts, posters, understanding how that vaccine is going to be paid for and that it is widely covered is really important. I mean, in the state of Wisconsin, some of our patients have Wisconsin Medicaid or senior care, which is a benefit for patients over 65. And sometimes I'm not sure the patients realize that they have that vaccine benefit there for them at no cost to them. Working with your community around vaccine availability and timing of clinics, et cetera, and then making vaccine referrals as appropriate to alternative clinics is a nice way just to illustrate, I think, to the patient of how important it is to get this vaccine if I'm making sure that the clinic has it on hand for you to get when you want to get it. So next slide. So with the next slide, I've got a culmination of the resources provided in this presentation. I want to thank you all for taking the time to listen to me talk about the importance of vaccination, and I welcome any questions. I believe you've got my email, and Casey will wrap up the presentation with any questions.
Thank you, Michelle. We'll go ahead and open up to any questions. I don't see anything in chat, but you can feel free to unmute your microphones and ask any questions as well at this time. I don't know who's monitoring chat, if they are seeing anything in the questions in the chat.
I don't see any questions in chat right now.
Okay.
I did just want to let everyone know, Casey, that actually Superior Health has quite a number of different resources available. I know Carrie did add there's a YouTube, it's on the YouTube channel, a presentation on motivational interviewing for those for vaccines. But we'll send up we're going to send a follow-up email. So in addition to the resources listed here on these slides, we'll send out those other resources that are available through Superior Health related to vaccines, just so you have those.
And there was a question regarding whether or not we had the slideshow. So there is a link to the PowerPoint presentation there as well. And so if there's not any more questions at this time, we're going to go ahead and go through the next pieces here. So your feedback is appreciated. At this time, we'll be adding a link to the chat to the evaluation survey for this session. Please take time to complete the evaluation so we can better support your needs. To receive your certificate of completion for the August 2024 Back to Basics August immunization update, please fill out this evaluation survey. We do have a couple polling questions, so I'm going to go ahead and turn that over to Jerry for those.
We'll just get these launched here. Hopefully everybody's seen the polling questions. And these are just, again, kind of the evaluation questions. You learned something today, and are you going to share that in practice and with your coworkers? We'll give everybody just a couple minute or two to answer. I saw quite a few comments in chat too that people really led the presentation. So we're just reinforcing it here with the polling question. And I'm gonna wrap that up here. So it looks like everybody found the information helpful and something that they will be sharing. And let's get the second one launched here. Hopefully everybody can see that. Our second polling question is just basically how satisfied were you with the presentation today? So we appreciate your feedback. So let us know if there's things we could have done differently.
That's still going, Jerry?
Yep. We'll take just another minute. No, 30 seconds if people want to wrap that one up. Okay. Close that then. So it looks like people either satisfied or very satisfied. So appreciate that. And again, any ways that we can improve, just let us know. I'll turn it back over to you, Casey.
All righty. So Superior Health has lots of services that we offer in addition to our Connect site and these webinars and services. We also have our health fairs. So Superior Health is offering health fairs with free mobile vaccination clinics to provide at no cost and easy access COVID-19 vaccines to older adults and communities throughout our region. Organizations can select education on topics relative to the communities they serve for the health fair. So if you're interested in scheduling a health fair and an immunization clinic, please reach out to immunizations@superiorhealthqa.org. So that is on that site. If you're interested in one of those health fairs, please reach out. And then as a final review, we'll see you again next month for our September 17th, 2024 session on health literacy. and chronic disease management. So next steps, go ahead and make sure you register for the September webinar. Looks like that still says August, but make sure you're registering for that September webinar. If you've registered for today's webinar, you should be registered for this series, but just to make sure that that is on your schedule. If you would like to share with a team member, please remind them to register for the webinar. Also, if you've not done so, sign up for the Superior Health Connect site, and it will provide additional questions. And if interested, one-on-one assistance will be provided, and Jerry will provide that. So her email address is listed here if you're interested in that additional one-on-one assistance. So again, please head over to that Superior Health Connect site. It helps us continue the conversations from today's session. You'll find some valuable resources, and you can ask questions on that site as well. And I think that's it, unless there's any further questions. Thank you very much, everyone. Have a great day.
Thanks,
Thank you,
everybody.
Michelle.
Yep.